So in this video, we are going to discuss the rotator cuff muscles, their clinical applications on the USMLE STEP1 exams and also clinically on the field. So the rotator cuff muscles are the muscles that help the movement of our shoulder, which is a ball and socket joint, freely. So this up, anteriorly, posteriorly, and down. So this how it looks like. The anatomy of it is the first thing we'll talk about. So the rotator cuff muscles are basically around the scapula. So this is a scapular bone here that you can see is a very flat bone. Is being covered by the muscles here, and the muscles that make them up are basically four, but from the back of the scapula we can see three of them. And so to understand this, we have to use the landmark here, which is this bone here, which is the bone here. This the spine of the scapula, the spine of the scapula. So this bone is what I mean, this bone over here, that's the spine of the scapula. And above it we can see one muscle here, which is the because it's above it, they name it the supra. Supra means above, so supra to the spine, so they call it supraspinatus muscle. And below it here we can also see a very large muscle, which is called the infra. Infra means below, so below the spine, so infraspinatus or infraspinatus muscle. And below all of them also we have a smaller muscle, which is down here, that is called the teres minor. Remember that the teres major, it's not part of the rotator cuff muscles. So we are missing one more muscle, which we cannot see because it's more anterior and is hiding behind all these muscles anteriorly. So if we take an MRI of the shoulder from the lateral view, this is what we are going to see. So assuming this is the spine of the scapula, all this red area, the short dashes here, they are the spine of the scapula. Then above it we'll have the supraspinatus muscle. And if we come at the backmost part, the back of it will have the infraspinatus here, and we have the teres minor here. But then when we come front of the bone anteriorly, then we'll have the subscapular, which is the fourth one that we did not mention in the previous slide. So it's the whole scapular bone, which is a flat bone around here, this way. And at the back of it we have this muscle, which is the infraspinatus. This is the supraspinatus, the teres minor, and then the subscapular muscle, or the subscapularis. And these are the four muscles that make up the rotator cuff muscles. Now if we do cadaver dissection, we can see it better than the MRI. So here we need to identify the spine, which is this bone over here, and above the spine we can find the supraspinatus muscle, and then below it we'll find a larger one here, which is the infraspinatus muscle, and below all of them we'll find the teres minor muscle here, which is labeled the teres minor muscles. So all these three muscles are mostly posterior. The anterior one, which is behind all these muscles, is not easy to be seen unless you remove the whole scapula from the back. Then you'll see the subscapular muscle. So this is a better view. So at the back, as we said, the posterior, we can see all the three muscles: the supraspinatus, the infraspinatus, the teres minor. And if you look at the front view, we'll find the subscapular. It's a very broad muscle that is lying behind all these muscles, and then it's at the front side of the scapula. And let's look at the functions of these muscles. So the functions of them, so the supraspinatus does elevation of the shoulder, it elevates it, but it only does that about 15 degrees, and then the deltoid, which is the proper shoulder muscle, does the rest of the elevation of the shoulder. The infraspinatus does external rotation of the shoulder joint, external rotation of the shoulder joint, and the teres minor also helps the same function. Now the subscapular does the internal rotation, so it allows the humerus to move freely and elevates the arm, but it does internal rotation. So a summary is what I have done here. So all these muscles, all the 4 muscles, their mnemonic is the sits, so we can also call them the sits muscles, which are here with sits muscles, and their functions, I have summarized them here. So supraspinatus does abduction of the shoulder. The infraspinatus does external rotation. The teres minor also does the same, external rotation, and the subscapular does internal rotation. So to quickly remember this for exam's sake, the mnemonic for the function is abuse, excellent, excellent, interns. So abuse is for abduction, excellent is for external rotation, another excellent for external rotation, and internal rotation is the intern. So the sits muscles, abuse, excellent, excellent, interns. Okay. Let's look at the nerve supply. So luckily, the nerve supply is not as broad as the function. So the nerve supply, so here are the muscles, the sits muscles here, and the functions are here, and then the nerve supply is on this column. So there's supraspinatus and the infraspinatus are both supplied by the suprascapular nerve. The teres minor is supplied by the axillary nerve, and the subscapular race is supplied by the subscapular nerve. We need to get this and make it very simple, because sometimes the question is asked about the function in the vignette. They tell you the function that is impaired, and then they want to ask you the muscle that is involved, which we know what is the nerve supply of that muscle. That is how it is. They put one of them in the question, and then they want you to guess the other. So like that. Something that we need to touch really quick, which is of clinical importance, is that the supraspinatus, we can use a test to test for its function. If it's weak, then the patient is not able to perform this function. So this is called the empty can test. The empty can test. So what it does is testing this muscle here, which is a supraspinatus muscle, this small muscle, which is a supraspinatus muscle. So the doctor or the examiner rotates the patient's hand such a way that the thumb is pointing downwards, as if the patient is pouring water from an empty can like this. So when we do that, we are using mostly we are tilting this muscle, which is the supraspinatus muscle. So now the examiner applies gentle pressure over the hand when it's tilted, pointing downwards, and the patient is asked to elevate the hand against the examiner's force. And so if the patient is not able to do that, then the patient has a negative, has failed the test. The patient has failed the test. So that will mean that we can diagnose that the supraspinatus muscle is weak. One more thing that I cannot conclude this video without talking about. This is not part of the rotator cuff muscles, but I need to include it in this video. So we can see some people get some kind of injury, and then the scapula becomes winged. The scapula protrudes behind. So what happens is when the patient comes, we ask them to put both hands against maybe a wall or a flat surface, and we realize that only one side, the injured side, will have the scapula protruding, just as we have in this patient. And then what the normal anatomy is that these muscles here, which are the serratus anterior muscles, What they do is that they hold the scapula and then bring it forward this way. They move the scapula forward so that it does not protrude. But injury to these muscles, if they are cut or their nerve supply, makes them flaccid, so the scapula is free to wink behind, as we see in this patient. The nerve supply to these muscles is the long thoracic nerve. So injury to the long thoracic nerve can cause winging of the scapula, or injury to the serratus anterior muscles, or can also cause a winging of the scapula. So it's something very important that we should know. Let's look at a few questions, like just 2 questions, and we bring the video to an end. So question 1 says, a healthy 49-year-old photographer presents to his primary doctor for an annual physical. When conducting a physical examination, you note that he has decreased range of motion in his right shoulder, along with what is seen in figure A. Upon questioning, he reports having to carry a heavy bag containing photography equipment over his right shoulder daily. Which of the following muscles is innervated by the injured nerve? And so, to approach this question, we have to know what is the muscle, or what. If you know what's in the muscle, just go for it straight away. But then the question says, which of the following muscles is innervated by the injured nerve? And we know the injured nerve is the long thoracic nerve. And what muscle does it supply? Supplies the serratus anterior muscle. So that is how the questions are asked. So this is a nerve that is being supplied, and then what muscle? This is a nerve that is coming. This is a nerve that is supplying the muscle, and they're asking what muscle. So it's the serratus anterior muscle. Let's look at the next question. This question reads: a 53-year-old man presents to the clinic with a 6-month history of shoulder pain that is especially bothersome at night. Over the weekend, he strained his shoulder during a pick-up basketball game, and reports an acute exacerbation of his pain symptoms. On examination, he complains of pain to palpation just below the acromion. You suspected he has torn his supraspinatus muscle. If correct, which of the functions or which of the functional maneuvers would you expect to be deficient on physical examination? So this question is asking about the function of the supraspinatus muscles, and we know the mnemonic is sits muscles do what? Abuse, excellent, interns. So if this is a supraspinatus, then straight away we know it is the first one. So this is the function that we are looking at. It's abduction. But then we have 2 abductions in our question stem. We have one abduction here. We have another abduction. So now, how do we figure out? We already said that the supraspinatus does only 15% of the rotation. So of the external the abduction, it does only 15% of the abduction. Therefore, the answer should be the initiation of the abduction. So take note. Question number 3 is the answer, the initiation of the abduction. The deltoid does the rest of it. So if it's 90%, if you are moving 90%, then the deltoid will do the rest of probably 45 to 75%. So the supraspinatus does 15, then the deltoid does the rest. So if you are moving from here to here, it's even about 180, right? Or close to 180. So just take note. So the initial one is the 15%, which is done by the supraspinatus. So thank you very much for watching this video. If you like this video, please put down some comments over there to show some love. Give us some thumbs up, share with your friends, and subscribe so that next time you will be notified when you click the bell as well. And thank you. I wish you good luck in your studies. Wish you good luck in your prep, and wish you good luck in your clinical practice. If you're writing the USMLE Step 1, I want to tell you that yes, you can do it. It's the same things that we see on the exam, and believe in yourself. Keep studying. Peace out.